really, sometimes I wonder. So I was diagnosed with end-stage renal failure, and so I was on dialysis for 10 years. Then I had a kidney transplant, but because of those 10 years that I was on dialysis, I have heart failure. 85% of patients get heart failure who are on dialysis. I didn't know this at that time because nobody had that conversation with me. I should have harmed the doctor, but I didn't. So now I've got heart failure, right? So my heart failure is not symptomatic apparently because I'm playing football, I'm doing a ton of things, I climbed a mountain, all those things I did. But I go to a heart failure specialist. My cardiologist is a specialist, right? And then so he looks at me, and when I tell him I want to climb a mountain, he goes like, why? Why are you doing these things? I said, I want to do. I know I had to challenge the thing. So I go there and I do it, and then I come back. And then eventually, a couple of years ago, now this is a 25-year journey till today, 25 years. So 23 years on, I'm having some electrocardio issues, right? And then the doctor looks at me and says, you need an ICD. So I have put an ICD in me. After he puts the ICD, then they do angiogram, and they find I have 2 more blocks, right? So he clears the blocks. After he clears the blocks, my heart is fine. And then the doctor is looking at me, so I'm looking at him and saying, listen, so I didn't need the ICD, did I? He says, yeah, probably not. So, should I harm my doctor? This is 23 years into it, right? So sometimes there's frustration. I trusted that person so much that I didn't second guess them. So there is a frustration on me. Sometimes now I'm using that experience to have that conversation with every other doctor and second guess it, not because I don't want to or I need to, but I guess I need to in a certain way. Because, so now I'm stuck with an ICD that every time I go to the airport, I have to tell them I have to go to a different line. Because of the magnetic and all that. So I'm conscious of it, and every time I travel to a different country and I go through a machine, I am aware that doctor, I should have asked him more questions. So I think telling these stories is very important. Just like Ram said, we look at data and they're all point numbers, but these numbers are somebody's father, mother, sister, brother, son, daughter. We need to shine the light on these people because a majority of healthcare people want to do good, but the numbers are just killing. They're just killing. Please reach out to us patients because I'm not the only one, Ram's not the only one, Uma's not the only one. There are thousands and thousands of these. And I have to tell you, I agree. We need to set up a system where you can find this. I'm a founder of VitalSigns.Asia. It's a healthcare portal. We will start to do this. We already have patient advocates from all over the world who are contributing to us. We want to put them on so that you can find them and you can connect with them. So I leave it with Dr. Krishna now.